You might think you're doing just fine. You take care of yourself, you stay active, you see your doctor once in a while. But what if you're making little mistakes every day that are quietly putting your health at risk? Doctors can often tell right away, just by looking at your hygiene. It's not about being dirty or lazy. It's about subtle signs your body gives off when something deeper is going wrong. The worst part? Many seniors have no idea they're doing anything wrong. So let's talk plainly. These 7 hygiene habits might look harmless, but they could be costing you your independence, your health, or even your life. Skipping proper oral care. Why it matters. Your mouth isn't just where you chew and talk. It's a direct path to your heart, brain, and other organs. When you skip brushing or flossing, bacteria builds up. That bacteria can sneak into your bloodstream through your gums and cause dangerous problems like heart infections, strokes, and even memory loss. What to look for? Bleeding gums. Bad breath, even after brushing, loose teeth, or gum pain. A toothbrush that's frayed, old, or overused. What to do? Use a new toothbrush every 3 months or sooner if it looks worn. Brush twice a day for 2 minutes. Set a timer. Floss every evening. No matter what. If your gums bleed or swell, see your dentist right away. Even if you have dentures, get a dental checkup twice a year. Number 2. Not bathing often enough. Why it matters. Skipping showers can let sweat, bacteria, and dead skin build up, which can hide serious conditions like liver or kidney disease. Your skin can show signs of trouble before you feel anything inside. Not bathing enough can also lead to rashes, infections, and itching that won't go away. What to look for? Itchy, dry, or flaky skin. Discoloration, yellow, dark, or red patches. Bad body odor even with deodorant, sores that aren't healing. What to do? Aim to bathe at least 3 times per week even if you're not active. Use fragrance-free soap that won't dry your skin. Apply lotion right after bathing while your skin is still damp. Check your skin weekly for any new spots, patches, or wounds. Ask a caregiver or loved one to help if bathing is physically hard. Number 3. Ignoring your nails. Your nails may seem like a small thing, but they actually say a lot about your overall health. If you haven't checked your fingernails or toenails in a while, it's time to take a closer look. Thick, yellow, or brittle nails aren't just about appearance, and they can signal things like fungal infections, poor circulation, or even serious issues like heart disease or diabetes. Some people think these changes are just part of getting older, but doctors know better. In fact, nail problems are often one of the first signs something deeper is going wrong in the body. Keep your nails trimmed, clean, and dry. If they start looking strange or hurt when you walk or press on them, don't wait. Get them checked. What looks like a minor issue could be a warning your body is giving you before something worse happens. Number 4. Covering up incontinence. Dealing with bladder leaks or not making it to the bathroom in time can be incredibly frustrating and even embarrassing, but it's also very common. Unfortunately, many older adults feel ashamed to talk about it. Instead of asking for help, they quietly try to manage it on their own, using tissues, wearing extra underwear, or changing clothes more often. But the truth is, covering up the problem doesn't solve it. In fact, it often makes things worse. Skin can break down from staying wet too long, which can lead to rashes, infections, and even painful sores. More importantly, incontinence might be your body's way of alerting you to something deeper, like an issue with the bladder, prostate, or pelvic floor. The good news? Doctors can help. There are treatments, products, and simple habits that can make life easier and more comfortable. So please don't suffer in silence. Talk to your doctor, not just for comfort, but because your life and health may depend on it. Number 5. Cleaning your ears the wrong way. Many older adults have developed a habit over the years of using cotton swabs, hairpins, or even rolled tissues to clean their ears. It might seem like a harmless way to stay clean, but this method is actually quite dangerous and often causes more harm than good. When you insert anything into the ear canal, you're not just removing wax, you're also pushing it deeper inside. This can create blockages, leading to a feeling of fullness, ringing in the ears, or even partial hearing loss. In some cases, people accidentally scratch or puncture the eardrum, which is both painful and may lead to permanent hearing damage. Seniors are especially vulnerable because as we age, the ear canal can become drier and more sensitive. Doctors recommend that you avoid putting anything inside your ears, not even a cotton swab. Instead, wipe only the outer part of your ear gently with a soft, damp cloth. If you're experiencing a buildup of wax or a blocked feeling, it's best to use wax softening drops sold at pharmacies or have your ears professionally cleaned. And if you notice pain, discharge, sudden hearing changes, or itching inside your ears, don't try to treat it yourself. See your doctor or an ear specialist. Taking care of your ears properly helps protect one of your most precious senses, your hearing, and can prevent infections and long-term damage. Number 6. Neglecting foot care. As we grow older, many people tend to pay less attention to their feet, often because they seem less important, or simply because it's harder to bend down or see them clearly. But in truth, your feet are some of the most important parts of your body to watch closely. They can give you early signs of major health problems. For seniors especially, small changes like cracked heels, dry skin, or even slight swelling can be warnings about conditions such as diabetes, poor circulation, or nerve damage. Unfortunately, these little symptoms are often brushed off as normal aging, when they are not. For example, a cut or sore that doesn't heal could become infected quickly, especially if your immune system is weaker or if you have diabetes. Sometimes you might not even feel a sore on your foot because of reduced sensation, a condition known as neuropathy. And that's even more dangerous because damage can happen silently. What can you do? Wash your feet every day with warm water and mild soap. Make sure you dry them gently but thoroughly, especially between the toes. Moisturize dry areas to prevent cracking, but avoid putting lotion between your toes as that can lead to fungus. Inspect your feet regularly. Even ask someone to help if it's hard for you to see them. Look for color changes, cuts, swelling, or areas that feel cold or numb. Wear soft, comfortable shoes that protect your feet and change your socks daily. And if you notice anything unusual, and don't wait, see a doctor or a podiatrist right away. Taking good care of your feet can prevent serious problems, keep you walking comfortably, and help you stay independent longer. Number 7. Not noticing hygiene changes caused by medications. Sometimes it's not about what you're doing, it's about what your medications are doing to you. Many older adults take multiple medicines every day for blood pressure, diabetes, arthritis, or other health issues. These medications often come with side effects that can sneak up on you, and they sometimes show up as changes in your hygiene. You might start to notice that your mouth feels unusually dry, even when you're drinking water regularly. Or maybe you begin to sweat more than usual, or there's a new unfamiliar odor to your body that wasn't there before, even though you're bathing just like always. These changes aren't because you're being careless or unclean. In many cases, they're signs that your body is reacting to your medication in ways you may not expect. Sadly, these early signs are easy to overlook or misinterpret. You might think, it's just old age, or maybe you feel embarrassed and you don't bring it up with your doctor. But doing that could be risky. These hygiene-related side effects could be the very first sign that your liver, kidneys, or other organs are under stress, or that your body isn't processing the medication properly. Instead of staying silent, write these changes down. Anything you notice about your skin, your smell, your mouth, or your sweating, share those notes with your doctor. Don't ever feel ashamed or afraid. Doctors see this all the time and they can usually help quickly. Sometimes all it takes is a small adjustment to your prescription. So if you've been thinking, something feels off but I don't know what, trust that instinct. You know your body better than anyone else. It's easy to brush off small health changes. Many people think, it's probably just part of getting older, or it's nothing to worry about. We might feel embarrassed about bringing up issues with our doctor, or feel like we're being overly dramatic. After all, a small change in how our body looks, feels, or smells doesn't seem like a big deal, especially when we're busy and managing so many other things in our lives. But here's the important truth. Ignoring these small signs and waiting until they become bigger problems could make it much harder to fix later. By the time something becomes very noticeable or painful, it may be harder to treat, and the issue could have already become serious. The earlier you notice a change, whether it's dry skin, a new odor, problems with your nails, or something else, the better the chances that it's something that can be fixed quickly with the right care. Your body gives you subtle clues that something might be wrong, and when you listen to these clues, it can prevent small problems from becoming big ones that can seriously affect your quality of life. The unfortunate truth is that many elderly people only seek help when things have already worsened, sometimes even when a health issue could have been prevented with earlier intervention. Whether it's taking a proactive step with your hygiene, asking about changes in your medication, or simply scheduling an extra checkup, taking action now can prevent a much more complicated situation later on. Don't let pride or fear hold you back from asking your doctor about these changes. They're here to help, and addressing the issue early can often mean less time spent in pain or discomfort. You don't have to go through it alone, and you don't have to just put up with it because you think it's just the way things are supposed to be as you age. Remember that staying healthy as you age isn't just about looking good or staying neat. It's about maintaining your independence, dignity, and enjoying the life you've worked so hard for. You deserve to live your golden years feeling good, comfortable, and confident in your own skin. So if something feels off, whether it's your feet, your mouth, your skin, or something else, don't wait until it's too late to get checked out. Early detection is key, and you deserve to have every opportunity to stay healthy for as long as possible. It's never too late to start caring for yourself and making small, meaningful changes that protect your health. By paying attention to the signals your body sends you and seeking medical advice when needed, you can catch potential issues early, address them, and live a fuller, healthier life. You have the power to make a difference in your health today, and that can lead to a much brighter and longer tomorrow.